most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So we're going to talk about today why you should not buy a massage gun, but we're also going to tell you why you should.
Sure. Yep.
And let's get right into it.
Put it right out there.
Number one, if you have hard to reach places, you might need a partner if you're using a massage gun. So obviously your back and upper traps.
You just cannot reach
Yeah,
back
you can't get the leverage on it. So
are we going to talk about that one?
Yeah, this one would work better for that, the handheld massager. But this doesn't have the power as much as a massage gun. It's fine. It's going to be fine for someone who is maybe a slighter build or, not as muscular.
Yeah. I mean, you may want to get one and have a gun too. These are not too expensive, and they have their place.
All right, next one. For disc herniations or sciatica, this is not going to heal a disc herniation or sciatica.
No.
I mean, you might feel better for some secondary reasons.
Yeah.
You know, like the muscles have tightened up because they're sore from the sciatica. But really, don't buy one of these if you think it's going to heal your sciatica.
Right. Again, you might feel better, but the nerve is still pinched, and it's got nothing to do with. Well, something to do, but yeah, I'm sorry.
Brad, do you want to talk about neck pain and headaches?
All the time.
Yeah.
Yeah, if you have neck pain, we're talking like here up.
Yes.
You're not going to use a massage gun on the neck here. The muscle's there, but you cannot do it without hitting
the bone.
The bone, the spine. And that spine is very delicate, if you will, when you're hammering on it, because that's what's going on. These are transversing back and forth.
Right,
and
percussion.
you could hurt your spine. As a matter of fact, you could cause a problem. I made a mistake years ago with one of these.
I did the same.
And I was massaging a patient's shoulder, and then I went up to the neck, and I saw by the look on his face I was doing the wrong thing, and I felt really bad as a therapist. I was like, what am I doing? And, anyways, it worked out fine.
You tried it on yourself, and you were like, "Oh my God!"
Don't go directly on it.
And
boy.
the same with the head. You wouldn't be doing it for a headache.
You're not going to do. Your temples, your head. You can do with your hands. That's it.
Right. It's just going to, and that leads us kind of to the next one, Brad. You really want to kind of avoid bony surfaces. There might be some exceptions, like when you have quadricep tendonitis, or you have the suprapatellar pouch. Sometimes you hit the kneecap a little bit, and you use the air-filled one.
Yeah, they're soft and squishy.
Yeah.
If you hit the edge of the bone, it's not so bad.
Yeah, even tendonitis, like if you have an elbow, if you have a tennis elbow or golfer's elbow.
You'll know if you get too close, it's going to hurt.
Yeah, it's going to hurt.
You don't massage that kind of in that fashion.
You shouldn't go over a pulse.
The neck, the brachial.
Right.
Yep.
The back of the knee.
Yep.
Right on the back of the knee. A lot of nerve artery veins there. I wouldn't go over your heart either. It's never a good idea.
Yeah. The other thing I don't know if you have this on, but don't go over lymph nodes.
No, I don't. That's a great one,
right.
Brad. That's a good point.
Particularly in the femoral crease, right here.
Right in the groin.
They're very superficial, right under the skin.
Well, obviously right under the elbow, armpit.
The axillary, yep. Because if you hit those lymph nodes, I mean, you could cause some problem. If not anything, you just irritate them. And I know I had some lymph node issues, and the doctor said, I thought it might be cancer. Well, he ruled that out. He says, if it's bothering you, just stay away from them because it's going to make them worse.
Sure.
So when you irritate a lymph node, it just gets worse, and it's no good.
Gotcha. All right. During pregnancy, obviously, don't go over the fetus. I mean, we always want to say that.
Obvious.
So, generally, you wouldn't do it over a bursa, and a bursa is a fluid-filled sac. If it's inflamed,
it'll be tender.
Right, it'll be tender. I wouldn't go over that.
And you have bursas in almost every joint to your
joints.
body, so that's kind of
you got to be careful.
Yeah, you're going over the muscle belly knot. You'll feel it.
If it makes the pain worse and the pain hurts afterwards, you shouldn't do it. All right, if you have a bleeding disorder or bruise easily, obviously you're not going to want to do the massage because it is pounding. I mean, it's percussion.
Yeah, if you're one of those people when you bump into a piece of furniture, you got a bruise there. You're going to bruise from this if you're getting aggressive, particularly. So, yeah, don't even think about it if you're really a bruiser, easily bruised.
Now, if you've had surgery, I want to make sure you have it approved by your physician or medical provider before you do massage because, like, after surgery, you're actually at higher risk for developing blood clots.
Sure.
Like, let's say you do a massage in your calf, you loosen the blood clot and send it up to your lungs, and it kills you.
Yeah.
So we obviously don't want that.
Right.
So I would avoid that. This is I would say, again, you want to get it approved by your doctor. If you have some type of nerve disorder, like if you have multiple sclerosis or epilepsy, unless it's approved, I wouldn't do it then either.
Right.
Open sores, obviously, skin tears, you don't want to go over. This is very obvious to us, Brad. I think you would think everybody would know this, but it's not. I guess people have done this before. They've had a broken bone or healing fracture, and they start massaging over it. So they want to make it feel better.
I mean, that could be well after it's healed and you've been walking on it, or many weeks after. Then you may want to have scar tissue to break up, but not during the healing process.
All right. Well, now, why would you buy one? And there actually is very good reasons why.
Yeah, I know a lot of them.
Yeah. One, it's very easy to use. You don't have to get on the floor like a foam roller. So if you can't get on the floor and you want to massage the area.
Talking about one of these which they work well, but
yes, they do.
You really, it takes more effort.
And the cost actually, like if you use one of the less expensive ones, is almost comparable to a foam roller.
Yeah.
So
or even one of these smaller ones that really do a heck of a job.
Yep. Many people, believe it or not, Brad and I have used this in our clinics for years, and I found like 50% of the people actually prefer the gun over our hands, or of our aides, I should say, our assistants.
I got to tell, we're not professional massage people,
right?
So we can't talk, but we know what we're doing as far as muscle groups, where to go.
We were taught.
We're trained, but it's not that. That's not like we're masseuses,
right?
So keep that in mind.
All right. It never gets tired, and it never says no to you.
Well, unless you run the battery down.
Yeah.
So you got to keep them charged up, but they hold a charge for quite some time.
Yeah. What's nice about it is you can also use it with the whole family. Generally, yeah. I mean, seriously,
I know.
Brad and I gave away some of these massage guns to some teachers. Brad, I am still getting great compliments from them.
Yeah.
And the one. The principal, he uses it every day. His kids say, "You're in love with this thing." I mean, it's just been funny.
Sure.
And other ones, another principal, she said her whole family uses it. Instead of going on vacation, they went to use the massage gun.
So did the principals kind of hog these things from
the
teachers?
Apparently so. You're a principal. You can do what you want. So. It's great. These are really great. I use them in this manner to warm up the muscles before I run.
Yeah. I should probably do that. That might
well,
help
problematic muscles.
Yeah.
I mean, I don't do it to all of them by any means. But seriously, I hit my calf muscles before I run.
Yep.
It's just a great way to stretch them out and get them warmed up before you go out.
Sure.
So you can also use them for cooling down. So, I mean, they're really great for that, too.
Sure.
And that's what I'm talking about, muscle recovery. But it's also good for muscle strains or scar tissue or tendonitis.
Yep.
It really works well for that because one thing, your hands are going to get tired if you're doing a self-massage.
Yep.
And this you can apply for 10 to 15 minutes, just like you should.
I'm telling you, for most people, I think I can speak across the board. If you've got a massage gun or you're going to massage by hand, the chances are if you're going to do it by hand, you might just, that's a lot of work. You might skip.
You'll do it for a little bit.
With this, you kind of look forward to it because it's so much easier. It feels good. And it just feels good when you're done. And if you get that feeling for the next 15 minutes or so, it's, I mean, these are popular for good reason.
Yeah, there's a reason. And the last thing, and this, I've given so many of these away, Brad. It's honestly one of the best gifts you can give.
It is.
It is. Yeah. I mean, there's not hardly anybody that's going to say, no, I don't want a massage gun. I mean, they all, most of them find out they really like it a lot more than they thought.
Sure.
They're surprised at how much they like it. So
just make sure you don't get the right one for the right person. I think like Mike's grandmother, she had one of these, and it was way too aggressive, and then she went to one of these, and it was much more appropriate.
Yeah. So this video is a part of a series of videos on massage. If you want to check out the entire series, go to bobbrad.com, go to the program section, and in that section you're going to find out a whole bunch of topics. Like we got a program on plantar fasciitis, we got a program on sciatica, tens, and shoulder, and some of the other ones are coming out. We don't have them up yet, but find the program on massage. Check it out. Figure out which videos you want to watch, because there are going to be like 20 of them, or 30, or 40, and
there'll be a bunch.
The ones that pertain to you. And Brad.
There is a PDF printout so that you can look through a review of the whole video you just looked at, print it out, and keep it handy until you basically memorized it.
And how much are we charging the people, Brad?
Absolutely. Bob, it's astonishing. Zero. Big zero.
It's our gift to you.
Not even an email.
No. Just come on and use it. Thanks for watching.